All right. Hi, everyone. This is Dr. Shweta Patel. Thanks for joining me today. Today's topic is going to be how you can take care of your, vaginal health, basically, and vulvar health. So commonly, one of the things we do is use vulva and vagina interchangeably, but they are actually not the same thing. Which is okay. Ultimately, I think the majority of us are referring to the right thing when we are talking about our vagina or talking about our vulva. But how do we practice good hygiene for our, hoo-ha? And what does good hygiene even mean, and why is it important? So I think that most women actually practice a little more aggressive hygiene than is necessary. And by that I mean, all we really do need to maintain a healthy pH in our vagina and in our vulva is lukewarm water. Anything beyond that is fine, as long as it's not something that you are doing aggressively every single day. And the reason for that is by using soap and water regularly or often, we are neutralizing our pH, and our pH in the vulva and vagina has to be very acidic. Not very, but think basic is like milk and acidic is like orange juice. So when we change from the orange juice environment to the milk environment, certain bacteria are able to thrive. The other part of it is when you are washing away all this bacteria that is supposed to be there, good or bad, you are allowing for yeast to finally have some room to grow. If this was like a civil war, there would be three parties in war. There's the yeast, there's the good bacteria, and there's the bad bacteria. And the highest population is of the good bacteria when things are at peace. And then in comes our, Irish Springs, or, it's odorless, colorless, Dove, or like one of my patients who actually said that she uses Dial antibacterial soap down there. In comes that, and it basically clears everything. Fastest growing to come back is yeast. And what normally keeps the yeast in check is good bacteria. But now they're not there, so the yeast has the option and finally the ability to grow. That leads to your yeast infection. Now, if that balance isn't restored quickly for whatever reason, be it that you are, the next day comes and you start washing aggressively again, and whatever bacteria your body was trying to build up and grow is gone again. And so the yeast has the opportunity to grow back fast again. If you're on antibiotics, which kills off good bacteria as well as the bacteria that you are taking the antibiotics for, that can also offset the balance and allow for yeast to thrive. If you have diabetes that's not controlled, or are kind of pre-diabetic, and the correlation there is yeast thrive on an environment with sugar. I mean, that's how we get our beer and wine. And so when you have uncontrolled blood sugar in your body, yeast like to stick around and they don't leave as easily. Or if you're immunocompromised, meaning yeast being such a very weak organism, they can't really take over our body unless our body is feeling down and out. So if you're sick, or if you have a chronic condition, if you're on steroids chronically, these are all scenarios where your body is kind of feeling under the weather on a low grade level regularly. And in that scenario, you are more prone to an overgrowth of yeast. And so those are the scenarios where you are probably creating or you are making yourself predisposed to yeast infections because of the chronic, excessive, or very aggressive washing. Now, if you are struggling with vaginal discharge and an odor, and this is something that no one likes to talk about, but you know what I'm talking about when you notice an odor. It's one of those things where you're like, wait, who's that? Is that me? Do I smell like that? Because it's not necessarily a horrible odor, but it's not you. And sometimes it can be associated with a fishy odor. That is because one of the bacteria in this a community of mixed flora, which is our vulva and vagina, one of the bacteria which we refer to as bad bacteria is Gardnerella. And that bacteria thrives when the environment is closer to milk. So when you're creating that, aggressive washing and creating that environment, which is closer to milk and less like orange juice, that bacteria starts to thrive and produce or overpopulate, and the good bacteria is outnumbered. So what happens? You have this odor, you have this discharge, and you feel like you smell bad. So the first thing you do, go to the shower, use a lot of soap down there, and wash it away. Make sure you're really clean, because it's obviously something related to poor hygiene. Guess what happens then? You're actually facilitating the infection into sticking around. And then the most common mistake that ends up happening is women think that when they have this odor and discharge, they confuse it with, this must be a yeast infection. And so they sometimes are treated for a yeast infection when they actually have a bacterial infection, which is a totally different treatment. The opposite is also true, and they may have a yeast infection or both, but they then are only treated for the bacterial infection, and that will actually make things worse for the yeast, because now you're treating the bad bacteria with antibiotics, which are also still killing the good bacteria. And now the yeast is like, great, I didn't have to do anything. Everybody just cleared out themselves. And so let's create some cottage cheese. And with that being said, the best way to maintain a healthy, the correct pH, odorless environment is to just lukewarm water, wash off any excess, towel pad dry, try to use comfortable garments that are not very tight or restrictive. I actually recommend going commando at bedtime, let the girl breathe, and avoiding things like taking hot soaking baths daily. I had a patient who was in menopause. She was actually maybe 65, 70 years old. Definitely was experiencing the effects of lack of estrogen down there. And she had a habit of taking a bath every single day using bubbles and hot water. She was essentially broiling her vagina every single day. And she had developed this redness and itching and discomfort. It just felt like her hoo-ha was on fire. And it was a simple fix. We traced it back down to what she was doing on a regular, what were her daily habits. And we're able to kind of figure out that it's because she is just depleting herself from all the normal environmental inhabitants. So next time you feel like you have to, scrub it down like you scrub down your armpits, think of it as like the comparableness to doing a chemical peel on your face every single day. We like to do face scrubs. We like to exfoliate, our skin can handle that. And then the chemical peel from time to time just to keep things nice and new and regenerating. But if you were to literally do a chemical peel every single day, you're going to develop a very red, inflamed, and very tender skin on your face. That's kind of what you're actually doing to your girl down there when you are washing and scrubbing with the loofah and making sure everything is spick and span down there, because you're just exfoliating the vulva and vagina from all of its good bacteria. And yes, you're also washing away the yeast and the bad bacteria, but the pH changes now will allow for a different population, the wrong kind, to grow back. So the first and foremost thing, stop doing that. Other things include, if you have like an active infection, not washing or washing with soap isn't going to just necessarily fix it. You can obviously discuss this with your doctor. They might recommend doing a swab or a quick test, and they would probably, depending on what you're having in symptoms, if it's a bacterial infection, they would recommend antibiotics. And usually we do a intravaginal cream as opposed to taking oral antibiotics. It actually is more effective when you're using the cream form because it's hitting the source, as opposed to going through the mouth, in through the magical school bus route, and actually killing some great bacteria in your gut along the way, and then affecting the actual vulvar and vaginal space. If you have a yeast infection, then the treatment is an antifungal. And so things like diflucan and monostat and all the vaginal creams, they are targeting from that side. They are not killing off bacteria. They're trying to get the yeast in check. And my personal favorite for yeast infections is just doing a single pill of diflucan. It's easy, it's not messy, and you're done in one. So, to recap, taking care of our girl is not very complicated. Lukewarm water and personally bona fide, it's all you need. Soap from time to time, especially when you're younger and you're able to regenerate all the good stuff sooner, and you won't need some downtime to create the turnover. But if you, as you get older or your estrogen levels decline, that ability to regenerate and handle the chronic exfoliation slows down, and so you're making yourself more prone to infections through your own personal habits. Lukewarm water, cotton underwear, or loose-fitting undergarments. Avoid using unnecessary treatments with antibiotics, and commando at bedtime. And if it's an infection that is bacterial in origin, antibiotics by your doctor. If it's a yeast infection, diflucan. One last thing, things that can make you more prone, as I had mentioned before, to reiterate, more prone to yeast infections is if you've got other chronic medical conditions that is compromising your immune system. Okay, so I hope this was helpful. I actually wanted to announce that I'm going to add on an extra live, particularly from one of my current viewers who is watching this, Priscilla. Thanks for watching, and I agree, I do need to do a episode or live on endometriosis. March is actually Endometriosis Awareness Month. I used to have it. I'm lucky that it's something that regressed for me, and so I will be doing a specific live on that next week, in addition to the lives that we've already planned. And updates on Gaya, we're still full-fledged away in terms of starting and personalizing our telehealth app, and as soon as that's launched, I will start doing all of the telehealth visits that I know some of you have been reaching out to me to try to coordinate. I love that you guys are trying to keep in touch. Please keep those direct messages and comments coming. Please share. We're close to 1,000 followers. I'm so excited, and so make sure your friends know about us. Make sure you're sharing this with your family, and I will see you soon. Love you guys.